Today I'm in Reading with Dr Bob Khanna, and he's going to be demonstrating his Facelift Deluxe, a non-surgical facelift which involves HIFU to tighten the skin, stimulate collagen, plus threads to actually lift and reposition the tissues. We're going to show you all of that, so stay with us. Bob, you've got a new procedure. This is the Dr BK Facelift Deluxe, non-surgical facelift.
Correct.
What does this involve?
There's never really been a satisfactory answer, non-surgically, to addressing the mid and lower facial sagging, and in particular the jowl area, the jawline, and then of course under the chin, the so-called submental region and neck. And it's always been a problem. So what have we done traditionally? We've tried fillers to try and bring about some sort of volumizing, to try and pseudo-lift the face. There are other techniques out there, using thermal devices and cannulas to try and bring about tightening. There's HIFU, there's radio frequency, and then of course there's surgery. So what I've tried to do is wrap this up into a very doable procedure for clinicians, but also something that patients can have done without too much downtime and get the results that they're trying to achieve.
Okay, now I've seen some of these results. They look amazing. So what are the techniques you're putting together in this package?
The Dr BK facelift is a combination of some groundbreaking technologies. Number one, using very advanced high-intense focused ultrasound, or HIFU, as well as using the very latest advanced thread lift system.
What kind of HIFU? Because there's HIFU and HIFU. What is this latest sort?
So this is using a dual beam technology, and the idea of that is, quite frankly, to avoid getting any collateral damage, particularly to the superficial skin. The analogy I want to give you is like cooking a steak in reverse. You know, if you cook a good steak, you know that you want to sort of cook from the outside and then don't overcook the inside unless you like it particularly well done. And if you do, I'm not going to talk to you ever again. But the point is, this is doing exactly the opposite, because the last thing you want is to actually burn the outer superficial skin. This is where the dual beam technology is very, very clever, because what it does is it only is activated on convergence of those two beams, the dual beams of the HIFU. So that convergence is set at a certain depth. Exactly, and that's predetermined. So there's several depths that we can use, 1.5 millimeters, 3 millimeters, 4.5 and beyond. But the idea is that we can target a particular region of the facial tissues and of course depth, and be very accurate in terms of our thermal change that we want to induce.
Okay, and then how do the threads come into it?
They're made of polyallactic acid and polycaprolactone. Together, and importantly, impregnated with HA now.
The PLLA and the polycaprolactone together, those will stimulate collagen?
Correct. But the important point being that they're longer lasting, a lot stronger than PDO, which only lasts maybe 6 months if you're lucky.
Goodness, so how long will these last?
These can last up to 2.5 years.
Right, and how many do you use and where do you put them?
So, depending on the case, I'll generally use around about 5 per side for the mid and the lower facial region. And then I will use a separate type of thread system for the submental jawline, the jowls, and of course the neck.
So you're putting threads in the neck?
Correct.
That's pretty advanced, isn't it?
It is indeed. One of the big problem areas that everybody complains of, certainly as you get older, is of course the diminishing jawline, the presence of jowling, and the accumulation of unnecessary facial tissue under this chin area. And that is actually an accumulation of not just fat, but also loose skin.
The whole tissue structure has kind of collapsed, hasn't it, as we lose bone and everything.
Exactly.
So where do these threads go in the neck? Are they where do you anchor them? Where do they reach through to?
Depending on the case, I generally will anchor them either just before the ear here, the so-called tragus, or behind the earlobe.
Wow.
And there's a beautiful ligament there that we attach to so that we get beautiful anchorage. But the important thing is that during this double hammock type procedure allows fixation at key points during the course of those threads.
Okay.
So not only are you anchoring just here, for example, you're actually anchoring into the jowl and also into the submental double chin area.
One thing people often worry about with threads is that they're going to be visible through the skin. How do you avoid that?
So if you place threads, generally speaking, too superficially, there is a potential for actually show through.
Yeah.
So the key is to actually make sure you place the threads appropriately for each case.
Who is your ideal candidate for this?
So essentially anybody who is concerned about the diminishing jawline, the accumulation of a jowl, and particularly this submental so-called double chin area, those patients are perfect for this procedure.
With this, you're going to get a better result than people might from something like FaceTite or Endolift.
Definitely. The results I've achieved so far have been quite outstanding. That's the cervico-mental angle there. That's just beautiful.
You've had the HIFU, you've had the threads. Would you ever add anything else into it?
What we've got to understand fundamentally is, number one, to reposition the tissues, the mid, the lower face and the submental region initially. That will inadvertently revolumize a lot of the areas that are deficient, okay?
Sure, so everything's just gone down and
correct.
You're just picking it back up.
Exactly. That's number one. Once that's done, there will still be the need in certain cases to add a little bit of volume, particularly in the mid-facial region, possibly in the nose to mouth area, the pre-jowl sulcus area around by the sort of lower part of the jawline. That's when I will employ my new face technique, which of course is part of this tri-series.
Okay. So you can add in that bit of volume. I think a lot of us don't appreciate how it's not so much a complete loss of volume as a flattening and sliding, and that's where threads are one of the few things that can help by actually picking the face up and
repositioning the tissues.
Exactly.
The over-reliance on just fillers to revolumize somebody's face and potentially pseudo-lift them is quite a flawed concept.
Okay.
So, and that's why we end up with these horrendous cases where people have been overfilled, because I think clinicians, practitioners all over the world are looking for a solution and are possibly restricted in what they can offer. Unfortunately, if you do have a hammer, everything does look like a nail.
For sure.
So what we've got to do is take a step back and actually look at the problem and say, well, what have we got here? We've got facial tissue that's sagging. That needs to be lifted. No ifs or buts about this. The facial tissues need to be lifted, and that's either non-surgically or surgically. Once you've achieved the desired elevation of the tissues, then you're in a very commanding situation to cherry pick the regions of the face that need to be then further tweaked. And that's the whole 360 approach to this.
How much does this hurt, and what is the recovery like? How much downtime?
To get the desired results, you have to go through a little bit of trauma, but of course it's minimal because of course we're avoiding any serious neurovascular damage, which is important. At the most, a little bit of bruising, a little bit of tenderness for up to about a week. Pain is very easily dealt with because, of course, we have local anesthesia. If appropriately managed, the actual procedure at the time is relatively painless.
Okay, and when do you see the kind of settling down of results? Will that be 2 weeks after it's done?
So I normally recall the patient after 2 to 3 weeks. And by that time, I find that pretty much all the bruising and swelling has subsided, and I get a realistic picture as to how things are shaping up.
Yeah, because it's the one thing we all do. We look in the mirror and do that, and this is essentially what you're doing, but That usually takes a facelift. How much can you achieve with threads?
The wonderful thing about this is that you can often role play the sort of level, the expectation for the patient prior to treatment, and then you can use the appropriate numbers and types of threads. All of these procedures must be performed in a manner that ensures that the patient still looks natural.
Yeah.
You know, we don't want patients to look overdone, and the vast majority of patients don't want that.
Yeah.
So my approach and my new protocols and concepts and techniques enable these procedures to be performed in a manner that is not only safe, but also achieves optimal, outstanding results that look very natural.
So this has shown you the sort of results you can get when you combine HIFU and threads in the Dr. BK Facelift Deluxe. It's quite impressive.